Welcome, and thank you for joining us today as we discuss the hepatitis A outbreak that's going on in Michigan right now. I'm Justin Henderson. I'm an epidemiologist with the Emergency Response and Enforcement Unit in the Michigan Department of Agriculture and Rural Development's Food and Dairy Division. With me is Jay Fiedler. He's a section manager for surveillance and infectious disease. Yeah, I didn't want to do that until I was for sure. Oh.
We are live. We're going back to the top, Justin. I think we had some technical difficulties.
Oh, okay then. We will re-welcome you and thank you again for joining us today as we discuss the hepatitis A outbreak that's going on in Michigan. So I'm Justin Henderson. I'm an epidemiologist with the Michigan Department of Agriculture and Rural Development's Emergency Response and Enforcement Unit. With me is Jay Fiedler. He's the section manager for surveillance and infectious disease epidemiology with the Michigan Department of Health and Human Services. So our departments regularly work together along with our federal and local health department partners to respond to foodborne illness outbreaks and diseases that affect the health and well-being of all Michigan residents. So during this session, we are going to present some information on the current hepatitis A outbreak that's going on and answer any questions that you might have for us. As we go through some of the things we want to cover, some of the background information, please post any questions that you have to the comments section. There are questions that we can't answer immediately. We will get back to you on those and post those answers in the comments section as soon as we can. So for a little background information on the outbreak. So we are currently, since August of 2016, experiencing a hepatitis A outbreak in Michigan. This week, the State Emergency Operations Center was activated to assist state agencies coordinating their response to the outbreak. As far as current cases and what the situation currently looks like, we last count had 486 cases of hepatitis A infection as part of the outbreak. About 84% of those have been hospitalized, so that's over 400 cases, and we've also had 18 deaths associated with the outbreak. The area that's been affected has been growing in recent weeks. Counties and jurisdictions include the city of Detroit, Calhoun County, Clare County, Genesee, Hillsdale, Huron, Ingham, Isabella, Lapeer, Livingston, Macomb, Monroe, Oakland, Sanilac, St. Clair, Washtenaw, and Wayne. So it's quite a list we have of affected areas. As that changes too, there may be updates to that list and to those case counts. So for the latest information, you can go check out www.michigan.gov/hepatitis-A outbreak. So for some more information on the public health, let's talk to Jay.
Thanks, Justin. We have some questions scripted out here that are pretty good to get us going. First, what is hepatitis A? Hepatitis A is a viral infection that is very easily transmitted from person to person. It is highly infectious, highly contagious. The symptoms of the virus themselves, and I'll read these directly from the information on the CDC website: fatigue, fever, loss of appetite, nausea, vomiting, abdominal pain, dark-colored urine, clay-colored bowel movements, joint pain, and jaundice. So a lot of those very non-specific symptoms, but they do really progress once you start to get to symptoms of jaundice when the virus is affecting your liver. People can protect themselves from hepatitis A in two main ways. Number one is vaccination. Vaccination for hepatitis A is highly effective in preventing the infection, a very safe and effective vaccine. In addition to that, just from a personal hygiene perspective, like we say with a lot of different things, wash your hands. Washing your hands helps prevent the spread from person to person because the virus is spread via what's called a fecal-oral route. So contaminated hands from feces can cause spread through food or surface contact. So washing your hands is a great way to prevent the transmission from person to person. When we talk about populations that are most at risk, both traditionally nationwide and in this outbreak, again, persons with direct contact with persons who have had hepatitis A, any kind of close household contacts, whether that be people that you care for or yourself, travelers to countries with high or endemic rates of hepatitis A infection, men who have sex with men, and users of injection and non-injection drugs are the primary things that we see nationwide. When it comes to the specific outbreak in Michigan, there's a few groups that have stood out, and those are mostly reflected in what we see in the national guidelines. Homelessness has been a major risk factor identified with this group, as well as individuals with documented substance abuse. So those are two of the big populations that we've been targeting. And then most recently, in the last couple of weeks, we've seen a bump in the number of cases in the MSM population. So in response to that, we've been working with local health departments in Michigan to target education, information, and vaccine towards those groups. We're trying to get all of those things out there to try to get a handle on this and get this outbreak under control. Additionally, we're trying to encourage very prompt public health follow-up of new cases so that when we do identify new folks who may be at high risk of transmitting the virus to other people, either through their work situation, if they work at a restaurant, they work at somewhere else where they've got exposure to the general public, and then also to encourage post-exposure prophylaxis within their household contacts and within their immediate community and personal contacts. So we do want to get good follow-up on those cases with post-exposure prophylaxis as a major step in trying to control this. So I think that segues into what you want to talk about regarding the food safety side of this, Justin.
Yeah, a little bit. So what is the Department of Agriculture and Rural Development's role in the outbreak? We do a lot of our work with other state and local partners to protect consumers and the food supply in Michigan. A lot of the investigations and support we provide for food safety and ill food worker investigations with our partner agencies is a big part of what we do. So when a new case might be identified in a food handler or a food worker, we quickly try and assess what the risk is to further spread via that person's work or contacts. So that's a big part of what we're trying to do to limit the impact of this outbreak. So speaking of food service establishments, food establishments in general, what can workers there and other people do to prevent the spread of hepatitis A? There's a few really big things that are worth mentioning. In the food, not touching ready-to-eat food with bare hands is a big one. So if somebody happens to be sick, it's very easy for them to contaminate food, and if that food doesn't then get cooked and the virus killed, then it's quite easy to further spread that virus to anybody who eats that food. So in addition to not touching ready-to-eat foods with bare hands, following all of the general safe food handling requirements. A really big one is hand washing. So even if somebody's sick, if they're properly washing their hands, it really reduces the chance that things are spread, though it's certainly still possible. It is a good way to limit the impact of further spread of the virus at that point. Another great way, as Jay mentioned, is getting vaccinated. So that is a safe and effective vaccine that's top of the list of the things that can be done to prevent further illness. So I don't know if we've had a whole lot of questions come up yet. So we had a few other things that we could hit on. One of the things that we have gotten asked about a few times is about why the hospitalization rate is so high for this outbreak. So we have over 400 people, 84% or so of the cases in total that have been hospitalized. So why is it?
It's a good question. We don't know exactly the answer to this question. It's something that we're looking into more even as we speak. And there are a couple of high-profile hepatitis A outbreaks going on in the United States right now, and it's reflected in those other areas too. One of the things that we're looking at is this is a relatively new strain to the U.S. So is it something about the strain of hepatitis itself that makes it more aggressive and results in more hospitalizations? Is it something about the population that it's impacting that's causing a higher hospitalization rate? So, both of those things are things that we're considering, but that's one of the questions that we've been asking, and we're looking to get more data on how to answer that question.
Yeah, so the fact that it's a newer strain, we just don't have a lot of pre-existing information to go from in some cases, right?
Sure.
Another question that we've gotten is why the State Emergency Operations Center was activated in response to this. And the main answer for that is just that we have several state agencies working on the response, and the activation of the State Emergency Operations Center just helps coordinate all the different response activities that are going on across state government. So that's why that is an ongoing activation and to help coordinate all of our efforts.
Sure. I mean, and look right here, you've got MDHHS and MDARD working on this jointly. You've also got Michigan Department of Corrections that's very interested in the population of folks that they're working with, and then state police also brings the resources and coordination. So I think it's a good move.
Absolutely. All right, so we do have a few questions. One from Margaret, what are the symptoms?
Symptoms, again, very general for the initial symptoms of this disease in the onset. Again, fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pain, and jaundice. Really, the initial presentations, you're getting those general, I don't feel good kind of symptoms that bring people in. Sometimes they'll seek healthcare early on. Symptoms usually last less than 2 months. And hepatitis A generally starts to resolve after the onset of jaundice. Folks can remain infectious about a week or so after that period. So, yeah,
and so to me it always occurred, jaundice is one of the more unique symptoms of hepatitis relative to some of the other possible foodborne pathogens that we spend our time working on. So, the yellowing of the skin and eyes that go along with that is pretty unique and often pretty obvious. But as Jay said, that sometimes happens later on in the course of the infection. So.
Yeah, one of the difficult things about hepatitis A is the long incubation period too. Incubation period can be up to 28 days. You may only start to become symptomatic for the second couple of weeks. We say you're infectious about 2 weeks before the onset of symptoms. So again, that's what makes finding those personal contacts and your food histories and your occupational histories important when it comes to trying to identify who else might be exposed. And then so it can take 2 or 3 weeks for symptoms to develop.
Yeah, and then during that time, that person may be likely as infectious, and so you may be able to spread the illness around before you even know really that you've got a serious infection. So that's would be a real problem for us. Another question, let's see, from Nancy, how is this spread?
How is it spread? Good one. Again, very well documented in the United States, person-to-person transmission and person-to-person fecal-oral route. So you have someone with contaminated hands or contaminated surfaces that result in transmitting either via food or hands to the mouth of another person. You ingest the virus. Again, very infectious, and it's very good at spreading via that route.
Yeah, so as a result of that, typically when we identify a new case, any close contacts of that case are usually given prophylaxis. They're given vaccine or immune globulin to prevent their illness, because we essentially just assume that they have been exposed just by being in close contact with somebody who's been infected. Good question. One from Joanne, is this in the Flint-Davison area? So we do know, we have added Genesee County to our list of counties in the outbreak area. So I would say, we can say yes, that all Genesee County now, from the public health perspective, is being considered part of the outbreak area, and will, be receiving the same kind of prevention and response efforts that the rest of the outbreak area is too.
Yeah, and so again, Justin, I'll take this opportunity to remind folks that Hepatitis A outbreak.com, Michigan.gov, Hepatitis A outbreak is where you can get future updates on the numbers, both total case counts and county breakdowns for where we're seeing these infections. So,
absolutely a good spot to go. We have information changes quickly as everybody's working on this at state, local level. For sure.
I think we have a question about someone tuned in late and asking about a recap, and would like to remind folks the entire video will be posted on the Facebook page. So it might be hard to do a broader recap at this point in time, but if you've got time to go back and take a look at the intro material that we provided, that'd be great. We'll try to hit on some of those same concepts though as we move through some
post your questions while we're going through, and we can we'll keep an eye on those and try to answer them as we go.
Yeah. Another question that we've got, where can I get vaccinated? Again, I've probably 3 things. Number 1, talk to your provider, first of all. Your provider may have you talk to your local health department. Is another good place where you can be vaccinated. And if those 2 options don't pan out, again, go back to the website. And for the counties that are impacted, we've got a good list of numbers for the local health departments, and then some information on active outreach and clinics that they may be providing as well.
Yeah, absolutely. Very good question. Let's see. What else do we have? Any other questions come in yet? Oh, so the question is this in epidemic level now? Very good question. Jay, what do you think?
Epidemic, outbreak, I think it's a fine line between what you call it. I think in our recent conversations, we've still been calling this an outbreak. I think that when we start, if hopefully we don't see this move statewide, I think if you see it move statewide, then we're going to be talking about this as an epidemic at that point in time. Given that it is more localized, it is spreading, but we've pretty consistently referred to this as an outbreak at this point in time. Again, the distinction's pretty fine line there.
And the same amount of concern, and effort goes into it. So very good. I don't have any new questions yet to go back to. Oh, one more time, somebody wanted to know the counties that were affected. So I can list those off again real quick. And again, the michigan.gov/hepatitis A outbreak is a great website that has, will have the latest information on it moving forward. So you can always refer to that. But City of Detroit, Calhoun, Clare, Genesee, Hillsdale, Huron, Ingham, Isabella, Lapeer, Livingston, Macomb, Monroe, Oakland, Sanilac, St. Clair, Washtenaw, and Wayne counties are those that are currently in the outbreak area, but as we've seen over the last year plus, that's expanded.
Yeah. So a couple of new questions. One regarding a specific question about someone who's having surgery and should they be vaccinated. I'm not a doctor. Talk to your providers, and raise that question. They should be able to answer that and address any of those concerns. And that's really the way to go. When in doubt, ask your healthcare provider. It's the best thing to do there.
Absolutely.
The other one I see, could this be related to California produce, which is an interesting topic, I think, in general, because it goes back to hepatitis A and what we typically see with hepatitis A versus what we're seeing right now. And, a lot of the times when we see hepatitis A outbreaks, we do think about things like produce and foodborne outbreaks. We recently had that contaminated strawberries that we had a lot of attention about, a lot of coordination between our agencies and outreach to the public there. Unfortunately, early on in this outbreak, it did start in Southeast Michigan, starting back, as Justin said, to August of 2016. Pretty elevated, slightly elevated, but lower levels, and we were never able to identify a common food item, a common community exposure that we could link that back to. So it is a good question in the sense that we do commonly see this associated with food and foodborne outbreaks, and we respond to those, but we haven't been able to identify a source like that, either to connect the Michigan cases back to, nor do I think I've seen anything like that for what's been going on in San Diego and some other states. Right,
but we don't currently suspect there's some ongoing food exposure that could be making folks continue to be sick, but what we definitely are seeing is that there's infections in the community and it's continuing to spread that way. A few more questions have come in. From Hannah, can you explain the difference between the different types? I can't remember which I was vaccinated for. It does get confusing. I totally appreciate that question. Yes. There's hepatitis A, B, C, D, and beyond.
Yes.
So it can be confusing.
So the hepatitis A is typically an acute viral infection, something that we see, like we just said, more associated with foodborne outbreaks traditionally in this country because it's not endemic in Michigan or in the U.S. We do tend to see this as a person-to-person transmission thing in, like I said, through contaminated food or person-to-person contact. Different than B and C, where you're talking about bloodborne infection and more of a chronic condition. So hepatitis A tends to be more of an acute viral infection. We don't see the chronic infections like we do with some of the other strains.
Right, and there are vaccines available both for hepatitis A and B, so you could have been vaccinated for either one of those or both. So that's definitely something to follow up on with your healthcare provider. If you're interested, they may be able to help you figure out which one you were previously vaccinated for so that you can stay up to date on those vaccines. Good question.
Yeah. Well, and the other thing that's interesting too is that hepatitis A vaccine is part of the childhood vaccine schedule now. So a lot of children or younger people are vaccinated routinely against hepatitis A as part of your childhood immunization series. So that's a good thing when it comes to the outbreak as a whole. We haven't seen a lot of cases in younger people. Only one very young individual infected as part of this outbreak. Everyone else is the age 20 or older. So our age range has been 20 up to 87, I think, in the high end of that. So.
Yep, and that vaccine's been available since at least the late 90s, I believe. So a lot of those folks in the younger age group are more likely to have received that vaccine already. So very good question there too. Let's see. Not seeing many other new questions. So again, if things come up that you're interested in, we may have a few coming yet.
Again, I see we got another question. What are the symptoms? That's really quick for us to run down.
And again, that's also on the website, so go there for your source of information once we're done here. It's a great source of information about the outbreak.
Yeah. Fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark-colored urine, clay-colored bowel movements, joint pain, jaundice. Some of those symptoms at the end are very classic for hepatitis A, and it's very recognizable by the healthcare community. But that's one of the things that we've done in addition, Justin, particularly in Southeast Michigan, but statewide as well. There has been a lot of messaging out to healthcare providers to increase awareness of the outbreak, so that folks have this on their differential diagnosis lists, so that healthcare providers are looking for this and making sure to get tests run and get it diagnosed as quickly as possible, so that we can identify those cases.
Absolutely. So I'll just run through another quick recap of the outbreak. Jay just went over the symptoms, but again, why we're here talking to you today, we are experiencing an outbreak of hepatitis A virus infection in Southeast Michigan, now expanding beyond what many of us would think of as just Southeast Michigan, but that is where it started back in August of 2016. Now we have 486 cases that are part of the outbreak. Over 84% of those have been hospitalized, and we do have 18 deaths that are associated. So we've just been talking a bit about what the Michigan Department of Health and Human Services and the Michigan Department of Agriculture and Rural Development have been working on, and trying to bring some of this information to you and answer some of your questions about the illness and what's being done and what you might be able to do to prevent the illness in yourself.
Sure. And one of those things, we have a question kind of related to this right now, is what is the vaccine? It's a pretty general question, but I'll hit on a couple of things. We are pushing vaccine as post-exposure prophylaxis and as primary prevention for the disease itself. The vaccines are typically single antigen vaccines that are delivered here in the United States. The vaccine itself is a hepatitis A vaccine. There are formulations that are hepatitis A and B, but you should be able to find a single antigen hepatitis A vaccine that can be administered for protection of yourself.
Yep. So Michelle has a question. Is there a blood test to see if you have it or not?
Well, yeah. Hepatitis A infections are commonly diagnosed via serology, which is a blood test performed by hospital laboratories. I know that it's performed by hospital laboratories, maybe performed by other people, but so that is typically the way that is diagnosed.
Yep. Good question, Michelle. Another question. Let's see. There was one.
It is a specific test, as that follow-up question asks. There is a specific panel that needs to be ordered that would include the hepatitis A serology.
Yep. So if you're wondering if you think you may need to request a test that would be able to detect whether you've been infected or not, it should be as easy as asking your healthcare provider, giving them your concern, like I think I may have been exposed to hepatitis A, and I'd like to be tested. They should be able to do that without a whole lot of trouble. So the more details you can give them, the better they'll be able to provide you a test that'll answer your question. And
I think to piggyback on that, if you do think that you've been exposed or there's an identified exposure in your community, say there's a restaurant where there was a infected food worker and that notice has been sent out, post-exposure prophylaxis within 14 days of exposure is very effective at stopping hepatitis A infection. And so all the more reason to ask those questions of your provider and determine if vaccine is right for you at that time.
Yeah, that 14-day window is really vital in preventing illness. Absolutely. Let's see. There's a question from Ray. Canada has had outbreaks in the 90s. Could it have gotten in the water and spread to us? We live near the border with St. Clair County. So just at first, I think, it's possible for hepatitis A to be transmitted via water. We haven't seen a lot of that in the United States in quite a while, since all of our sanitation improvements, and certainly not since the vaccine's been out and routinely given to folks, so that there's a lot of immunity out in the population and it doesn't spread. So it's possible to be spread via water, but I would say it's unlikely that it would have kind of crossed borders via that route.
Yeah, I think even in the CDC documentation that I've been reviewing recently, there's spread via water can happen in more endemic countries, and that's due to issues like you described with sanitation and other things, but not typically a route that we see in the United States.
Right.
Primary route, person-to-person transmission.
Yep, absolutely. That is a good question.
Do we have another one out there?
Okay,
No?
I guess that might wrap up what we've got now. Again, this will be posted to the website after we're done here, so that you should be able to get the repeat performance if you like. But in the meantime, please check out this website. It's got all the latest information on it, case counts, the area that's affected, some recommendations for what to do to protect yourself and others. So please use that as your main resource. So thanks again for watching, and we appreciate your attention, and we will continue to be updating that website and doing what we can to limit the effect of this outbreak on the citizens of Michigan.
Thanks, Justin.
Thanks, Jay.